Today we are presenting over the topic of diabetes awareness. Contributed to this project would be LeNhu, Lillian, Stephen Le, Henry Okafor, and myself, Nguyen. What is diabetes? Diabetes is a chronic or a lifetime disease which is caused by a high blood glucose levels in our body. There are two types of diabetes. Type 1, where the body cannot produce any insulin. Type 2, where the insulin that is being produced in our body is not working effectively. Focusing on type 2 diabetes. Well, diabetes type 2 is commonly found in senior populations. If you have diabetes, you are at a very high risk to have high blood pressure, heart diseases, strokes, and other serious conditions, and also obesity is related to diabetes. What are the signs and symptoms of diabetes? You will experience a frequent urination, always hungry, always tired, sudden weight loss, wounds that won't heal, blurred vision, always sleepy, and numbing of hands and feet. Hypoglycemia occurs when you have a low blood sugar level. It occurs when you are missing a meal. Therefore, you need to immediately take glucose tablets, drink juice or soda. Common symptoms of hypoglycemia would be feeling cold, trembling, tired, irritability, or confusion. Also, blurred vision, headache, dizziness, and also fainting. Hyperglycemia is caused by overeating, reduced inactivity, missed insulin, and may develop over hours or days where there is a raise in insulin level. The common symptoms of hyperglycemia would be an increase in thirst and using the restroom too frequently, breath smells very sweet, feeling tired, anxiety, and confusion. And also, there's a weight loss. In this case, you need to contact your doctors immediately. You can manage diabetes by eating healthy, checking your blood glucose, taking your medication on time, more exercise, quit smoking, and keeping your doctor's appointment, and learn more about diabetes. You can manage diabetes by eating healthy, maintaining a proper diet by avoiding eating trans fat, avoid food with too much sugar, and eat more vegetables and fruits. If you are having any problems preparing a meal, there are always services that are available to help you, which is Meals on Wheels, which help to provide delivered meals on a regular basis. To keep your blood glucose under control, you need to use your blood glucose monitor daily to check if your blood level is high and in the normal range. In addition, you want to keep stock of diabetes test strips and lancets on hand just in case of emergency. When managing your medication cabinet, you want to keep a list of all your medications, take your medications and inject insulin on time or as directed by your healthcare provider. And you also want to use only one pharmacy to fill medication and also use a pill organizer to manage your medication. In addition to managing your medications, you also want to manage your weight by exercising for at least 30 minutes every day or 150 minutes every week. Walk for 20 to 30 minutes a day. In doing so, you can cut your weight down by 5 to 7%, which will decrease your risk of diabetes by 50%. There are basic tests that can be done to test for diabetes. An A1C test measures the average blood glucose level that are in the body for the last 2 to 3 months. Maintain your blood pressure in the normal range of 120/80. A urine albumin test to see how the kidney is working or if it's functioning properly. Also, there are foot exams to detect further signs of diabetes complications. If you want to learn more about diabetes, please visit or call these support groups or go to www.yourdiabetesinfo.org or www.diabetes.org for more information.
It sucks.
You're depressed about the big 3-0, aren't you?
No, Julia, I'm not depressed about the big 3-0.
It is scary to say you're diabetic. I mean, you can lose work because of it. But, I mean, that's who I am, and I've always spoken freely about whatever I was dealing with. And I learned how to, on the set, have certain kind of snacks that were readily available to me. I test my blood sugar in public, and I'll give myself shots in front of people, and after a while, it becomes normal. And that was a wonderful thing to realize, that I could go on with my work as long as I kept my blood sugar at a good point and was prepared with things nearby.
As fate would have it, Delta found an ally in her former co-star Jean Smart, who had been diagnosed with type 1 diabetes at age 13.
I could talk to Jean, you know, I would talk to Jean a little about it, and we would test blood sugar levels. And she was jealous of mine.
Oh, I just can't believe you feel this way.
By the time she left Designing Women in 1991, Delta's weight ballooned to more than 200 pounds.
You know, that was very depressing and frustrating, and it took years to lose it, because I would lose it very slowly, like 10 pounds a year.
Then in 2005, Delta went on Byetta.
I would take it and wait my 20 minutes and then eat, and it really did help, and I did lose. I think I lost another 18 pounds. So, you know, and the more that I'm able to lose, the better the blood sugar does. So that was a nice little added bonus. But my hardest part is the exercise. I hate to exercise, so I try to do it with the walks. My husband and I will do walks. We would just walk up and down the neighborhood, and try and do a couple miles. You can make a difference. You can keep healthier. It doesn't have to take over.
I hope you've enjoyed this D-Life video. I'm Nicole Johnson, host of D-Life TV and a person with diabetes. If you have diabetes or have a loved one with diabetes, there is so much more waiting for you at dlife.com. Get inspired, informed, and connected. Check it out.